Brixton Park Hospital to talk to Dr. James Murphy. Dr. Murphy, James, you finished foundation. What stage are you now at in your training as a doctor?
Well, I've just come through the foundation programme and I'm now in my first year of specialist training in paediatrics in the Oxford Deanery. I studied medicine on the 4-year course at Warwick University, and before that I did a degree at Leeds in pharmacology.
So what stage did you choose paediatrics as your specialty?
Well, really, it was a dead heat between that, general practice and core medical training right up until the applications. I put applications in for all of them. But the interviews came for paediatrics first, and I'd actually secured jobs before any of the other interviews came about, and when I weighed up my experience I decided paediatrics was probably for the best.
So was foundation a good experience? What were the best things?
Yeah, foundation training is amazing. Yeah, I had a great time. I think probably one of the best things was maybe about a month into the job when I'd successfully cannulated a few people that I didn't feel quite like a fraud when I introduced myself as a doctor to my patients. Other than that, I did my F1 at University College Hospital. I looked after a few famous people, which was quite interesting, and I remember that my surgical consultant took a few of us to his gentleman's club for Pall Mall as a thank you at the end of the year. That was certainly a highlight.
And I think you did something for the UKFPO as well, didn't you?
Yeah, that's right. I was lucky to be selected as the National Doctor Advisor, so I set up a committee with representatives from every foundation school, and hopefully we did help in the creation of the new foundation programme curriculum and things like that.
So there's some good times. What about the worse experiences?
Thankfully not too many, but I would say probably dealing with the death of a patient is always difficult for any doctor, but certainly when you've just qualified. In my experience though, there were lots of people on hand to talk to, and there was actually some formal debriefing sessions as well, and these were really useful, and I'd say that anyone should avoid keeping those emotions inside, but discuss them with other people.
So, with the benefit of hindsight, if you were to do it all again, what would you do differently now?
Yeah, I think one of the things would be to do a taster in general practice. You see, I'd had direct experience through my rotations in paediatrics and in medicine, but I didn't get a GP rotation. So I've heard from other people that have done them that they're a really good way of getting an insight into that speciality. So I think, yeah, it would have been nice to have that fully rounded picture when it came to applications.
So what tips have you got for people just entering foundation now?
Yeah, I think it's difficult. You need to think career really early. Even though you're dealing with a transition from medical student to junior doctor, you need to be thinking about what you want to do and how you're going to make yourself competitive when it comes to interviews. I think teaching is a really great way of separating yourself out from the competition. I've got friends that, one of them set up a national teaching programme which was really useful for his application, and another person that set up a teaching revision course for final year students. I think audit is also a great way. I, as an F1, managed to get involved with an audit with some senior colleagues in obstetrics, which ended up being presented at an international conference, and I learned a lot about the speciality, and that certainly, I think, helped my CV as well.
And even if you don't get into a rotation, I think you've got advice to go and seek people out and talk to them.
Absolutely. I've never heard of anyone being turned away from a consultant's door if a junior colleague takes an interest in their speciality. They're usually more than happy to talk about things, maybe even offer you the opportunity to go and spend a day on the wards with them.
You talked about presentations, but what about the portfolio?
Yeah, the portfolio becomes even more important now that some specialities are requesting that you bring that along to the interviews for specialist training. So you really need to give that your full attention. It will help you structure your learning through the foundation programme, and will really help, through the CBDs, KECs and DOPS, help you point out to you which issues you need to improve on. So,
Dr. Murphy, thank you for your time and best of luck in the rest of your career.
Thank you very much.